Okay, so hello everyone. Thank you all for coming to this Mental Health Nursing Grad Year Forum, and welcome to those who are watching this recording. I hope this is an excellent opportunity for you to envisage your future career. So first, I would like to start by acknowledging the traditional custodians of the land. Where I am located at is the land of Wurundjeri people, and I pay my respect to their elders past, present, and emerging. And I also like to acknowledge the ongoing contributions Indigenous Australians make to both to the university and to the wider Australian society. Now, special thanks for all my mental health nursing colleagues here who, as panel members, there are mental health nurses who I have personal respect for their contribution to the workforce and also expertise within their area of practice. So from the left, we have Ms. Hannah Growell, who is continuing care coordinator at Origin and emergency mental health nurse at the Royal Children's Hospital. And then we have Ms. Claire Mangan. She graduated from La Trobe last year, this year, so she did MHI last year, and she's a current grad nurse at Bendigo Health. And then there's me, and then there's Roxy, Ms. Roxanne Dimano, who is currently clinical nurse educator at the Origin Youth Health. And then we have Mr. Daniel Darmanin, who is a senior mental health nurse consultant at the Origin Youth Health. So I know that we do have lots of Origin people here, and that was a happy coincidence. These nurses have worked across many other services too, so we'll be able to actually answer most of the questions. So we do want to make it rather informal and friendly place to ask questions and talk about mental health nursing. But first, we will hear each panel's mental health nursing journey and go through the commonly asked questions first before we open it up to everyone. So I'm going to ask each of you to introduce yourself and tell us a little bit about your mental health nursing career journey so far briefly. And as a chair, I'm going to be mindful of time limit a little bit. So I might actually ask you to move on if you go for too long. So apologies if that comes across a little bit rude, but let's start. So let's start with Hannah, because you are just on the chair.
Thanks, Hosu. So I actually started nursing out of school and then decided it was boring and quit and did paramedicine for a few years before coming back and finishing my nursing degree. And at that point, knowing that I wanted to go into mental health. I did my grad and postgrad through forensic care, and I've spent, I guess, a good portion of my mental health nursing career in forensic mental health. But I've also done a bit of work with people with eating disorders, and more recently I've been focused on working with young people. So recently I've come to Origin. Prior to that I was working in youth justice, and yeah, I guess that sums up most of my career.
Claire?
Yeah, hi. So I'm Claire. I'm based on Dja Dja Wurrung country. I grew up near the Grampians, actually. So I'm a rural girl at heart. Moved to Bendigo for high school and then moved to Melbourne for my first degree, which was back 15 years ago now, but that was a commerce degree. So I went off and had a career in marketing, working mainly in the finance area. And then when we moved back to Bendigo, I knew my heart was not in the right spot, that the career wasn't what I really wanted to do. And that's how I decided to go back and study nursing. As far as my mental health nursing career goes, I'm in my first 6 months. So I'm 4 months in to my grad rotation. I'm working in the adult acute unit at Bendigo Health. So it's a 34-bed unit. It's got a high intensity area with 8 beds, and the rest are all low intensity area. So the catchment that we look after is quite large. It's like a lot of Victoria. So we see people right throughout Victoria. They all come to the Bendigo Hospital if they require inpatient treatment.
Thank you, Claire. Roxy?
Hi, everyone. Yes, I'm Roxy. So I started my nursing career. So I graduated from Federation University in Ballarat, and then I went on to do my graduate program with Northwestern Mental Health. So mainly around the inner west area, Royal Melbourne, and also did some northern area, Northern Hospital. When I finished my postgrad studies, I stayed at John Cade Level 2, which is an eating disorder and neuropsychiatry unit. Give or take, I was there about 4 or 5 years and thought, wanted to do some other stuff. I found myself as a grad coordinator. So looking after undergrad, doing interviews and recruiting for graduate positions with Northwestern Mental Health. And now I'm doing a secondment, covering maternity leave at Origin Inpatient as the clinical nurse educator. Thank you.
Thank you so much, Roxanne. And Daniel.
Thanks, Hosu. I commenced employment straight out of, I completed my undergraduate straight out of high school. So did 3 years undergrad and then did my grad and postgrad year with Northwestern Mental Health. Following those 2 years, I moved over to the Royal Children's Hospital and I chose to specialise in youth mental health for about an 8-year period. And during that time, kind of just did differing roles like ANUM, Acting Nurse Unit Manager, Care Coordinator. And the 2 more recent roles were Co-Grade Coordinator, so overseeing occupational violence and aggression for the hospital, and also working as a clinical nurse consultant. I returned to Northwestern Mental Health, again, specialising in youth, working at Origin. Did my first year at Origin as clinical nurse consultant. And more recently, I've moved to the area senior nurse consultant role. Concurrently, I also teach a Cert 4 in mental health through GenU. So that's kind of where I'm at the moment.
Thank you, Daniel. And you probably realized that Hannah and Daniel are also part of our teaching team. So if you were in their classes, they might look familiar. So now I'm going to ask you guys each, why did you decide to become a mental health nurse? Just briefly. We'll start with Hannah again. Thank you.
I guess I always had an interest in mental health, although I've also been really interested in the acute physical health care side of things, which is how I ended up being a paramedic. But even while I was working in that space, I felt really drawn to the people with mental health issues that I was working with. And I really felt like I wanted to do more and work for a longer time rather than only seeing them in a very brief crisis. And I also started to think about my work-life balance as well and what kind of career opportunities I wanted to have. And so thinking about what I would really enjoy and what would also be part of a really great life. This was something that I chose, and I feel like it's worked out really well. And I guess the longer that I've worked in this space, the even more enthusiastic I feel about working in mental health and continuing to learn. There's just so much, which is great.
Thank you, Claire.
Well, I surprised myself in going into mental health.
Sorry, I think I might just ask everyone to mute. Apart from the people who are obviously speaking. So thank you, Claire. Sorry to interrupt. Go on.
No, that's okay. I had no plan at all of doing mental health nursing until I did my placement in mental health nursing in older persons unit at Bendigo Health, and loved it. I think I enjoyed the fact that it wasn't with clinical, it's very regimented the way that you are doing your nursing, whereas there is almost like a high level of skill that comes into the way that you do mental health nursing, because you're dealing with people and no people are the same. And so you really have to get to know them and work out the best way to interact with them. And I have always liked a challenge. So I saw that doing mental health nursing, I would actually be able to stretch myself, know, 2 shifts would be the same. And so far that has been exactly what it has been like. It has been very full on, but you don't know what you're getting when you walk into a shift, but you always leave feeling like you've actually made a difference, which is really good.
Great, thank you. And given that I'm the next, I'm going to tell you a little bit about why I decided to become a mental health nurse. It's very similar to Claire. I really like that mental health nursing was not task oriented, other like general nursing, and also I found it quite intellectually stimulating. Also, I really like that it's very collaborative. If you go to placements, you'll understand what I mean, that it's not as hierarchical in mental health services. A lot of decisions are very team oriented compared to other medical areas, and the team, including medical team and allied health, they do really respect your opinion and perspective as nurses. So I was really attracted to mental health nursing for that reason. Thank you. Roxy?
Yeah, I guess a lot of us are the same in mental health nursing by the sounds of it. I initially wanted to do pediatrics or midwifery, but I had a rotation as an undergrad, so clinical placement at forensic care. And I think I just had a really top-notch buddy nurse preceptor while I was there. And I mean, the way he just spoke to consumers, the way he handled situations, there was just a lot of the process of being a mental health nurse just fascinated me quite a lot. And I guess that helped me pursue not only being a mental health nurse, but yeah, in the path for clinical education. Because I mean, your buddy nurses and your preceptors really do enlighten your nursing career. So yeah, that's my goal there too.
Great, thank you, Roxy. And Daniel?
Thanks, Osu. Yeah, so I just kind of jumped into nursing. I didn't have a passion for it. I just thought, I don't know what to do with my life. So I went into it, followed my cousin's footsteps, but I never regretted it. I remember in my undergraduate placement working with a woman who had a cardiac event, and she was on the floor for 48 hours and wasn't able to speak to anyone. And she said to me, I actually prefer being in hospital because I get to talk to people. And I thought, just goes to show you just how prevalent, mental illness, loneliness is within our society. So, I thought definitely worthwhile specializing in mental health. And I thought it was well suited to my strengths, and just it's a real privilege to be able to care for some of the most vulnerable people within our society. And I genuinely believe working in mental health, allows us to support, those people who just really need support. So yeah, that's kind of why I went into mental health and why I've stayed for so long.
Well, that's great to hear, and thank you for such honest answers too. And I absolutely agree that being a mental health nurse is a privileged position. People really open up to you, and they do talk to you about their life, and you get to really help people learning their stories and about that person. So I absolutely agree that it's such a privileged position to be in. So that locate us to the next question, which is, what do you like about being a mental health nurse? So we'll just go again, Hannah, starting with you. If you don't like that I start with you, you can say we can start from the other side. But if you're happy to go first, then please do.
I don't mind. That's okay. I guess we've kind of touched on it already in some of the things others have said, but it is such a privilege to work in this space. And like you said, it is quite intellectually stimulating. I think you really have to think thoughtfully about the work that you do. It's not, you can't show up with your eyes closed and kind of mindlessly go through the day. And I like having to think about what I'm doing. I think it's been really a good challenge to think about how to work with other people, how to talk to people, how to support people through some of the most difficult times in their lives, and how to think about life and mental health and recovery in a different way. And I guess I'd also say that I like having quite a holistic approach to health, including physical health. And I've certainly continued to have focus on that and an interest in that and develop my skills in that area, even whilst being a mental health nurse as well.
Great, thank you for talking about that. And we will actually elaborate a little bit more on that, because students are sometimes worried that if they go into mental health nursing, that they may lose physical side of skills. So thank you for touching on that. Claire, what do you like about being a mental health nurse, Claire?
I think it being such a specialty area, because I don't know whether other people have noticed this, but when a mental health patient comes in and if they need to be on medical ward or an ED, often it's a can't touch this, it's out of my area, I can't support someone that needs mental health services. And to be able to step in, for me, it's been such a big change, because, you know, like when you see that person on the street mumbling to themselves, the last thing you think is you'd be able to go up to them and help them, you'd be avoiding them. Whereas I've realized how easy it is to actually start a conversation with these people and how interesting they actually are. And so I just love the fact that, yeah, it's changed my whole perspective on life and on people. And I really feel like my own life has been enriched by becoming a mental health nurse and learning those skills of how to talk to people with mental health issues.
Yeah, Claire, thank you so much for that. And as you can see by us just going like this, we absolutely agree with that. And I do think that being a mental health nurse, you do learn a lot and grow a lot as a person. And that's one of the things that I love about mental health nursing. And I think my favorite part of mental health, being a mental health nurse, I think is for me is my colleagues. Mental health nursing do tend to attract people that are very, not just mental health nurses, but psychiatry as whole, so medical colleagues and allied health as well. But they tend to attract very kind people with very good sense of humor. Do you agree? So yeah, I just really liked working with people in mental health services. It does attract a lot of really good people. Roxy, which is one of my colleagues.
Yeah, I think definitely I would have to agree with that, Hersu, because we are workmates as well as friends, so can't say no to it. But definitely it is all about the people. I mean, not just the staff, the nurses that you work with, down all the way to like your PSAs, your admin, your medical staff, but also definitely the consumers that you do meet along the way. And I mean, reflecting on me as a grad up to now, the amount of people that I've met, the amount of stories that I've heard, the amount of, I guess, experience that I've accumulated really adds up. And I mean, I know that it's going to continue building from, you know, still continuing. And it is all about that learning in mental health nursing, because you'll always come across something that, you know, you're not going to be familiar with, or someone's going to say something to you and you're not going to know the response to it. And, you know, you're just going to keep learning through, you know, being a mental health nurse, and it's just great.
Absolutely. Thank you, Roxy. Our last, Daniel.
Thanks, Hosu. So just kind of mirroring whatever everyone's already said, you know, just working with colleagues, I find mental health nurses, we have a very dry sense of humour, but I think it's very consistent with mental health nursing, but it just means we're able to bond quite quickly and, you know, kind of unify within our respective teams. The other thing I personally found in moving towards mental health was that there's no hierarchies in mental health care. So I found that it was more hierarchical in general settings, whereas I think everyone has an equal voice in you know, mental health systems, which is obviously quite good. But just working with consumers and their family carers, just being able to talk and have those genuine open conversations. In mental health, you'll see the best of humanity, but you'll also see stories about the worst of humanity, which can be hard at times. But again, it's just that privilege of being able to provide the care when people are at their lowest, and longitudinally to see them get better. And I think obviously there's three of us on the panel from Origin, but you know, with youth, we do get in early. So just to be able to see them improve and recover, you know, it's quite rewarding in terms of seeking out a career in mental health.
Thank you so much. I loved hearing about your stories, and I ask these questions every year, and I even ask, well, we even talk about this in social lives, like, you know, why did you become a mental health nurse, or what do you like about, and these are very similar themes that come, like, I've never actually met a mental health nurse who don't really like our job. So I'm really glad to hear all these stories from you guys. Now, I'm going to start asking one or two people specific questions. And if you actually want to add anything, please feel free to do so. So I'm going to ask Roxy, because she's a CNE and she has experience in recruiting grad nurses. So in general, what do you look for in a grad nurse?
I guess I want to say, people like us. It's all about the personality, I think, when it comes to mental health, because, we know that as an undergrad, you don't really get a lot of that experience in mental health. I mean, you get, I think, one placement and that's it. So, experience will be easily acquired once you're in that position. So we want to just see, I guess, your passion and your drive and just that willingness to learn. Because, we want to make sure that your career as a mental health nurse is worthwhile. And we want to see that, that reflection of yourself and your clinical skills, definitely.
Absolutely. And I think that is so important. The medication that you don't know, you can learn that the next day. It's not about the knowledge, but it's really about the attitude and what kind of person you are. So if the person is very self-aware, the person is a mature person, that kind of stuff. And I don't think that that's only within nursing. I remember when I was in the management position and interviewing doctors, we weren't really looking at their, the grade. We were really looking at what kind of person they are and if we really want to work with them. So that's really, really important point. Thank you, Roxy. And I'm going to ask you another question about that. What kind of support, and also very practically, they would ask questions like, what is your understanding of recovery-oriented practice, for example, right? Is that right? And given that you guys all done assessment too beautifully, I'm sure you can really answer that well. But anyway.
Absolutely. Can I just make a comment just on the type of person? Because I'm in with a team of grads that we're going through the mental health program at the same time. And I'd just like to say that different personalities work for different patients. So there's not really a cookie cutter type of person that makes a good mental health nurse, because we are all quite different people, and you'll see that some of us will bond or create a rapport much better with particular patients than other people will. So it was something I was concerned about, that perhaps from my background I wouldn't be very good at being a mental health nurse because I couldn't relate to a lot of the people that I'd be dealing with. But I've really found that I have a particular type of patient that I work really well with, and then some of my other grads will work really well with different types of people. So I just wanted to put that out there, that there's no one type of personality that works really well as a mental health nurse, I don't think.
That's absolutely right. And also I'm going to ask Hannah and Daniel, because they do have extensive experience in management. Expensive as well, I'm sure. So
not expensive enough, Hosu.
So you guys are very expensive, I know, and thank you for coming here for free. Thank you, guys. So can you guys just give us a little bit of interview tips, because I know that you guys know a lot of interviews of the senior stuff in your career so far. So just brief tip about interview.
Do you want to go first, Hannah? Do you want me to go? I don't.
Up to you. How about you go first this time?
Oh, all right, cool. Thank you. So I think it's just really important to prepare for interview. What I find is sometimes nursing staff applying for grad years, they're not well versed in interviewing, which is fine, but just practicing being confident in answering questions can go a long way. Typical questions that we'll ask will ask you, why have you applied for this job? So make sure you prepare for that. Sometimes people say, oh, just because I think it'll be a great organization, and then want us to move to question 2. So we want content, learning about the organization's values, the different wards and departments within the service can be helpful. What skills, strengths you bring, and also what areas for growth you have as an individual. But don't be afraid to ask as potential interviewers to repeat the question as well. Sometimes people get flustered, and to be fair, also sometimes we ask you 3 questions at the one time. Like, why did you apply for this job? Why do you think you'd be good at it? What do you want to get from this job? So I hate those 3-pronged questions because they normally slip me up, but just ask them to repeat it and say, have I missed anything or any other things from the question that I need to answer or extend on. But yeah, above all else, I think practice is really important.
Thank you, Daniel. They're really good tips. I really appreciate that. What about you, Hannah?
Yeah, I'd agree with what Daniel said. I think most people feel anxious about having an interview, and that continues throughout your whole career. So don't feel like your anxiety about it is a reflection on your skill or your ability to get the job. Interviewers expect that you will be feeling anxious, and it's okay. That's typical. I think the other thing is to be aware, I guess, that interviewers are looking to get to know you and to get a sense of your attitude and your approach to your work and your learning. So even when you don't know everything, having an openness to learning and an enthusiasm for that is really important. And I often look for people with a good attitude more than people that know everything or think that they know everything, because realistically, none of us actually know everything. And it is good to ask people to repeat the question if you didn't get it or you've forgotten it. Really normal when you're feeling anxious to instantly forget the question or halfway through your sentence forget what you were talking about. And that happens all the time for people even applying for senior roles. Yeah, I guess it's good to think about some questions that you might be asked. And a lot of times people might ask you for an example. So it's not just what do you think about something or what do you know about organization, but tell us an example of when you've had to deal with conflict at work, or can you give us an example where you've supported a consumer? And you can use examples from really any of your experiences in work and volunteer experiences, and it doesn't have to be health related to still be relevant. And think about your experiences on placement. I know that I had done some work in disability, and I've had, other experiences separate to nursing that were really useful examples. And they're just as good to use. It's more about being able to answer the question, I guess, and describe your skills rather than already being a perfect nurse, because we know that that's not true for any of us.
That's right. Thank you so much, Hannah. And keep the questions coming on the chat. We will actually answer that after we finish all the questions that we have prepared for. But thank you very much. And there were really good tips, not just for grad nurses, but anybody who needs to do an interview in the future. So again, for Roxy, I'm going to ask you this. If students get a grad year, and also Claire, you can answer this as well, what kind of support do they get? And I'm going to do what Daniel hates and ask you two questions now. What kind of support did they get? And also, how does the rotation usually look like?
I know rehearsal, you did tell me not to be too area specific.
Yes, not organization specific.
Yeah, I'll try my best. Yeah, I know in terms of long-term support for graduate nurses, there's always graduate coordinators who obviously work with you when you do start with the organization. There's a specific time frame that they'll give you to provide you that extra, I guess, support in your mental health nursing skills. Because I mean, you do your mental health placement and your studies, I think, second year for most unis. Third year? Oh, there you go. But most of the times it's the second year. So, just remembering all of the stuff that you learned from that time that you did your mental health course can be really difficult. So, we provide that refresher for our graduates, just going over kind of your basic mental health stuff, the Mental Health Act, doing MSCs, just your general medications. And I mean, once you are then allocated, so generally you do 3 rotations during your grad year, and you'll go into different areas. So that means you'll have your own clinical nurse educators there, and you've got the support of all of your staff members that will be working with you there. And that's not limited to just your nursing staff, whole multidisciplinary team, including allied health. Got a lot of lived experience workforce that you can learn a lot from. So definitely support is not lacking as a grad mental health.
Yeah, and the rotations, Roxy mentioned that you do 2 or 3 rotations. Just to give them a little bit of ideas of how they look like, we can just quickly just say what you've done in your rotation. So I did general psychiatry and eating disorders rotation. What did you guys do?
So I did mainly acute inpatient rotations, and the specialist one is for eating disorder and neuropsychiatry. Yeah.
What about you, Daniel?
I actually had 7, which is highly unusual.
When was that? Can I ask when that, what year was that?
Maybe 12 years ago. It was supposed to be 6, but I got the option of moving early.
Including postgrad year?
That was grad and postgrad, sorry,
Yeah,
yes.
yeah,
So I apologize. So 3 for the grad year.
Yep.
I was going to ask you how long those rotations, 7 in your grad year.
No, sorry. So I started off at John Cade as well, John Cade 2, so eating disorders. Did a stint at Broadmeadows inpatient unit, and then finished up with Broadmeadows community care unit.
Yeah, and then what about your postgrad here? What did you do?
So postgrad was Amaru, Origin, MST, and the Royal Children's Hospital, which was kind of like an agreement between services. Yeah, which is why I then moved on and did 8 years at the Children's.
What's Amaru, just for students who don't know?
So adult mental health rehabilitation unit.
Yep.
So it's for consumers who might need a little bit more time in their recovery to support them with their overall psychosocial recovery. So it tends to be much more long-term. You're looking probably 6 months to a year of treatment.
Yeah, then inpatient unit. Thank you so much. So just because I think a lot of students are a little bit confused about grad year and post-grad year, I'm going to explain it a little bit. So because, like Roxy said, and you guys are aware, we have only one subject. Most universities have one subject when it comes to mental health nursing. So when people finish their Bachelor of Nursing, they are equipped to work in general nursing, but not in mental health nursing. So what we do is we have first grad year and then second postgraduate year. And usually the grade year, you do 2 or 3 rotations, and then again, you do 2 or 3 rotations, usually 2 rotations in post-grade year. And that tends to be a little bit more specialized as community or sometimes like CAT team or something like that. What happens in the second year is that you're still working full time for both years. And I'm sure I know there are lots of organizations that higher 0.8 basis these days too, but usually if it's full time, you are also being paid to go to your university. So most times this is now online, and Hannah and I and Daniel, I know that we've done it at Melbourne, and that was face-to-face when we did it. So I remember we would, for example, Wednesdays, I would get paid exactly as working, but I will be at uni listening to the lecture. It was great. It was really, really supportive. So once you finish that second year of doing the postgraduate year, you come out with something called the Graduate Diploma of Mental Health Nursing. Once you have that, if you do 6 more months, a semester, then you actually come out with master's degree. And that's why you will see that most of mental health nurses do have master's degree, because we're almost quite expected to have postgraduate diploma to work in any areas. And then people just do, okay, I'll just do 6 more months, and then they come out with master's degree. So a lot of us are quite specialized and also have higher degree, which can probably what contributes to mental health nurses being paid a little bit better. I think that's something that students are also interested to hear. But yeah, so we do both years, but you don't necessarily have to do it right after the grad. You don't have to do your post-grad right after grad year, but most of grads do post-grad straight after their grad year, and that's quite it's really well supported through organizations. So
can I just explain? It's actually quite different here in Bendigo. We do the 3 rotations, but once we're in the mental health program, we commence our grad dip straight away. So we are doing a 0.8 FTE, and we're also studying the La Trobe graduate diploma in mental health nursing at the same time. So the way that they get around that to make it a little bit easier for us is that we have 12 compulsory study days. And as long as you attend all 12 compulsory study days throughout the year, that first year, which is your grad year, then 2 of the units are taken care of, basically. So you don't have to do anything else for that. So you've got 6 units that you need to complete during your graduate year, and then you come out at the end of the 12 months with your grad year and also a grad dip in mental health nursing with La Trobe. And then you can go on and do the final 6 months as well. The way it's sort of explained to us is because our rotations are a little bit different, because Bendigo isn't as specialised as what Melbourne is. We've got the inpatient units, which sound quite similar to what Melbourne is, but we also have a number of the community units as well. And so generally during your 3 rotations, you will do a combination of inpatient and community. Now, when you're doing an inpatient one, you are actually a nurse that is responsible for a patient load independently. But during the community ones, you are supernumerary the entire time. So because they have an expectation that you have a master's in mental health nursing before you do community mental health nursing, you would never be responsible for patients independently. But it is a fantastic way to see what that other side is all about, because they sort of, the way it was described to me is that inpatient is a great thing to start off with, and you're expected to do a couple of years in inpatient before you would be moving out into a community-based setting. And so, but at the same time, being able to do a 4-month rotation through community means you get a really good understanding of what the patients are going to experience once they get to community. If they've come from inpatient, they often go into a community-based setting. So yeah, it's a really good way to get a great exposure to all the different areas that are offered within the Bendigo setting.
Absolutely. And we will answer all the chat questions, and I will send you the answers in the chat later as well to people who are here. So don't worry too much about remembering everything. But also, that's right. So when you do the second year of postgraduate diploma, if you've done a grad year, they give you the credits. So you don't have to do like 2 subjects or something. But just to give you a little bit of idea of what kind of stuff that you study if you do the postgraduate diploma. I'm just going to speak about Melbourne Uni, because that's most of us done where postgrad did for Northwestern Mental Health. Royal Melbourne Hospital is right next door, and they usually have that connection. So we've all did it different years, but when I did it, we would have the whole subject about psychopharmacology, for example. So you know those little lectures that you've watched, that's the whole subject. So they give you, for an example, I don't know if you had to do this, but for an exam, they'll just give you like a blank paper and you have to actually draw a neuron and how antidepressant works in the brain. Or they'll do a therapeutic subjects where all you learn is doing CBT, DBT, different therapies. We also had a subject called consumer perspective, where our lecturer was a consumer researcher, where they talk about consumer movements, all the different, supported decision-making, mental health act, everything from consumer perspective. We also had assessment subject, where all you do for the whole subject, you learn how to really assess the person. So do a proper formulation. It's not just the MSc, but proper formulation, really learn about people's precipitating factors, all those things. So, but it's usually very related to your work. So you tend to use a lot of your work as scenarios. So it's not something like uni is separate and work is separate. It's very connected. I'm going to move on. Oh, the next question was, what's the option for master's and postgraduate training? So we've done that, and I'm sure that most of the universities do have quite nice postgraduate mental health nursing degrees, but it just depends on which organization you're with, because they often have already arranged things. So for example, I believe that with Northwestern Mental Health, it was either Melbourne Uni or RMIT. Roxy, you did it at RMIT, right? Did you want to talk just a little bit about what kind of things you had to study, just really briefly?
I wish I could remember it the same way as you did. But to be honest with you, I think I went from my grad straight to my postgrad, and all I remember was learning a lot about work-life balance.
That's a very important thing to learn about. So good. That's good that you've learned that. That's good.
I honestly was just trying to get through my postgrad and working full-time at the same time.
Well,
so kudos to you for remembering your subjects, but all I remember is passing.
You learn about work and life balance, and here you are in front of your laptop at 6:42. So I'm not sure if but we're going to move on to the next question.
Hey ho, Sue. I have put answers to some of the questions in the chat. And also you didn't ask me about my rotations, so I'm just going to jump in and tell you. Because I did forensic mental health, so my rotations were a bit different, and I worked in acute and subacute in a forensic secure hospital setting. And I also did rotations through prison mental health units and court liaison as well.
Yes, that's really interesting, and that's really good that you're talking about that, because the next question is, what kind of career pathway is available? And I'm going to ask that to our senior members here. When I say senior, I'm not talking about your age. So senior as in your experience. Hannah and Daniel, can I please ask, can you please elaborate on what kind of career pathway is available in mental health nursing?
Want me to start, Hannah?
Maybe I'll start this time. We'll alternate.
Sounds good.
So I guess the first thing I'd say is that when I decided to go into mental health nursing, I thought there would be a good range of career options, but it's only since working in the space that it still surprises me just how many opportunities there are. And once you get to a point where you've finished your grad program, and when you finish your postgrad program and you have that qualification, you are so employable. You can do almost anything you're interested in. And I am still learning about new roles and new opportunities now. And I honestly feel like I could change job every year and still not have done everything. There's so much opportunity to move around. You're not committing yourself to life for any one role. And people might work several years in one place and then try something completely different. Your skills are really transferable, but there's so many different ways to use them. And even so far, I've worked in really different settings and supporting people in really different ways. So I guess, there's so many options to be in hospital settings and a lot of variety within just different hospital settings, working with youth or adults or older adults or specifically with women. And, there's mother-baby units, there's a lot of variety within community teams, so much different focus. And I've worked in prison and court settings as well. So that's really, again, very different to hospital or community. And yeah, there's just so much. If you go on to Seek and you have a look at what jobs are available, they're not things that you'll apply for right now, but you can see how many different things exist, and they are not out of reach for you. It'll only be a short time before you're looking at those roles to apply for, and you've got so much choice.
Absolutely. And I think one of the thing about mental health nursing, people are a little bit worried that, oh, what if I get stuck in mental health nursing and if I can't get out? It's just, there's so much available different areas within mental health nursing that, to be honest, like what I do as a lecturer, I'm a mental health nurse, but in research and education, be completely different to Daniel, for example, who's a senior nurse consultant. It's just that not just there are so many specialties within mental health nursing, but there are just so many different roles that require different skills. Well, I guess there are lots of transferable skills too, but you're never really stuck in one area. It's not like we are very similar, if that makes sense. So Daniel, I might ask you too.
Yeah, thanks, Hosu. Hannah, you were quite exhaustive, so there's not a lot I can add, but one thing I will say is capacity for growth is significant in mental health at the moment. So coinciding with the Royal Commission's finding into Victoria's mental health system, a lot more funding is going into the sector. There's a lot more new roles that are being developed. And I will say, being very forward with you all, you're in significant demand. We probably haven't been in such a dire shortage of nursing staff, and this is across the board, not just mental health specific, but you know, we're really needing staff to support us to maintain systems and provide good quality care. But the sky's the limit. You know, I see in the chat that some people are worried about grad programs. Generally, as a rule, if you try, if you come to the interview and, you know, we can see clearly that you're empathetic, you're wanting to support people, as a general rule, you will get a grad year. But, you know, there's plenty of community positions. So hospital in the home, you know, assessment teams like youth assessment team, YAT, CAT for adults, APAT for aged persons. We're also seeing a burgeoning nurse practitioner workforce. So for those of you that want to maintain or specialise in physical health in the mental health setting, that's something that you could aspire to work towards. You know, Roxanne's a CNE, so providing education and maintaining nursing standards, which falls within my remit as well. There's also prevention and recovery centres, community care units, which again ties in with that psychosocial rehabilitation. A new thing that's popped up is HOPE teams. So if people present with suicidal ideation in the emergency department and they're at a lower risk, they can be discharged, but HOPE provides assertive outreach to support those people. You know, and even Hannah's background working in custodial settings. Yeah, and that I've only touched the tip of it, as has Hannah. There's just that much out there. You can really, you know, find the role that you know, fits your niche well.
Absolutely, there's so much. And also, when you're looking for a job, I guess this is not so relevant for you right now, but because we're called mental health clinicians, and that could be RPN or OT or social worker or psychologist, people don't often know that we're actually nurses, but sometimes the title is mental health clinician. So it's less visible. I feel like mental health nursing is less visible to general public as nurses, but mental health nurses are actually the biggest workforce of Australian mental health services. And like Daniel said, the funding, there's so much funding into the newer workforce. So you will have so much scholarships, you will have lots of, they're creating so many jobs. So I don't think that you need to worry about, well, do I need to pay for the postgraduate diploma, or will I not have a job? That will never be a mental health nurse's problem. I think tomorrow, if I need to get a job in mental health nursing somewhere, I think I'll be able to do that. It's yeah, the opportunities, there's so much. And I guess because also that lack of nursing workforce, that also means that you do get to, if you are willing to, you can have higher responsibilities pretty early in your career. So you can do a lot of other opportunities apart from clinical work. So if you're interested in management, education, research, project work, they're all also available. I'm going to ask a question, and anybody can answer this question. And I think Daniel already touched on this, and Hannah touched on this as well. But do you really lose nursing skills, physical nursing skills, if you go into mental health nursing? Don't we love this question?
No. I heard this a lot when I said that I was going to go into mental health, even from some really senior nurses who I respected. And I was really disappointed to hear when they said this. And I certainly questioned my decision, thinking, oh, I don't want to lose skills. I want to improve my skills. I guess the reality of nursing is that in every different area of nursing, whether it's cardiac or emergency or pediatric, you learn different sets of skills and you learn new skills when you move to a different area. But there are a huge amount of skills that you learn in mental health, and they apply to all areas of nursing. Plus, you continue to develop your assessment skills as well. So, I'm still taking blood pressures and giving injections and assessing someone's metabolic status, and I've taken bloods. I've responded to emergency situations, given medication. It looks different to what you might see on a med-surg unit, but they're still valid and important nursing skills. And when I've moved to different areas to work, I've learned different skills and added to that skill set. So it's not losing skills, it's just different skills.
And I can say, as Roxy can probably say this as well, we worked in eating disorders unit. That's so much physical general nursing, to be honest. You are continually monitoring somebody's metabolic status, inserting the gastric tube, doing bloods every day. So yeah, and CL, the CL, the consultant liaison psychiatry nurses who actually work in medical unit to consult about their, give them the psychiatric assessments, they actually do work within that general setting as well. So anyone else want to add to this? Or
if I can just add, we know that people with mental ill health, they'll normally die 10 to 20 years younger than other population groups within society. And to be fair, historically, from a mental health context, it probably was something that was neglected, physical health, because we focused on the mental ill health. But we're definitely moving away from that. We've been doing that probably for the last 20 years. Recovery is all encompassing. So it's not just about mental ill health, it's about spiritual well-being, emotional well-being, and also physical health and well-being of each individual consumer. Can I say for myself, I chair a physical health working group at Origin. So it's not something that you just lose. It's like anything in life, really, not just pertaining to nursing. If you want to lose the skills, you probably will. But if you want to maintain them, you'll maintain them. You'll be able to, consolidate them with time as well. But what I will say is, as I said earlier, mental health nursing is not moving away from physical health. In fact, we're probably spending more and more time tending to the holistic needs of our consumers. So, I wouldn't be afraid of losing my skills if you do choose to specialise in mental health.
Absolutely.
And I'd just like to say, as a grad, so my shift today, if I think about what I did on my shift today, I did vitals. I did bloods to check lithium levels due to medication to make sure that was in a therapeutic range. I then had to check that on the computer. I then took a patient down to receive ECT and then picked that patient up again. So that's going down to day surgery and then receiving a handover from the recovery nurse on the status of the patient, then taking them back up. And I also got to give an IM injection with 4 security guards holding down the patient. So that was a high intense situation, which you would never experience on a normal medical ward. So you do get to do a range of different medical things that you might not necessarily relate to mental health nursing. And that's as a grad. So it's not like it's further down the track. That was me today on a shift. Yeah,
thank you. And also, that's really good to hear the actual day. It's almost like the day in life of mental health grad nursing. I'm actually interested that you talked about the security guards, because I'm really glad that no one asked this question this year. And I guess we're really, as a society, we're moving away from that stigma. But usually people used to ask, is mental health nursing dangerous or violent? And in my whole, of course it differs in the settings, and other people can add. But for me, my whole nursing career, I think I was in one code gray, and that you guys in the emergency department or ICU, people have 6 within a shift. But for me, it was like the whole career of mental health nursing. I had 1 or 2 code grays. So I'm really glad that I don't see that question. But if you ever wondered, it's actually, for me at least, I have not been subject to any violence within in my nursing career. If anyone wants to add to that, please do. And I think we do learn a lot of trainings, and we do get trained a lot in how to manage those situations. So people's behavior probably don't escalate to the point that people are violent, as they may be on the street or in the emergency department. But yeah, anyone else want to add to that, or should I move on?
I mean, we as a group received self-defense training within our orientation week, just because we are going into that high intensity inpatient setting. I do deal with code greys on a regular basis, and deal with takedowns and moving people into seclusion areas. But I think that's a skill set in itself. And I think a lot of it is that safe wards, the de-escalation, the trying to pick it up before it actually gets to the point where they're escalating to the point where they need to have security called and a code grey happen. So I think everyone's getting better, but it is part of my job regularly that we are actually dealing with that sort of thing. But I mean, look, it's a good skill to have, and like it's an interesting shift when that all.
Yeah, but I think also there are definitely differences between services and areas, because I guess Melbourne Metro is really trying to move away from any restrictive practices and really emphasize on trauma-informed practices. But yeah, definitely that is skill that we do learn in mental health nursing. I'm just a bit aware of time, so I'm going to move on. Should I do general and mental health nursing half-half? I'm going to give you a very quick answer. The answer is no. It's because either pick one. You have so much to learn in general nursing. You have so much to learn in mental health nursing. If you go half-half, you're going to come out not really, having enough time in either areas. So I'd say just go into one that you like. But people ask, can I go to general nursing first and then come to mental health nursing? And as we know, there are lots of programs that retrain general nurses to do that. But I'm usually a little bit, I tend to be personally a little bit against that, because when people go to general nursing and have that habit of seeing people as illness and really having very task-focused nursing approach, when they come to mental health nursing, it's really hard for people to really get rid of that very general nursing task-focused habits. So for me, I tend to like people that, well, if I was the manager who was hiring, I tend to like people who've started mental health nursing from the get-go, but it depends on the person. And if you guys want to add anything else to that, what do you think?
I've hired a lot of people who started in general and also people who've started in mental health, and I'm really keen on supporting anyone into a mental health career regardless of where they've started. I think probably what I'd keep in mind is whatever decision you make, whether you get a grad program or you don't, if you pick a half program or you don't, it's not a lifelong decision, and there's always opportunities to move on. So in the same way that we reflect back on high school and see that, it didn't define your entire life as much as people told you, this is kind of the same. Whatever program you choose will teach you amazing skills and will contribute to you being an excellent nurse. And there's no perfect pathway. You don't end up being a better nurse because you've picked a better grad program necessarily. So pick what feels best for you and right for your life, and then go from there.
That's so much more of an eloquent answer. Thank you, Hannah, for that. Actually, that's a really good segue to the next question, because the next question was, how do you apply as an international student? And what Hannah said about your first year of nursing does not define your career. Always remember that. So for international students who can't go through the computer match, just start anywhere. So for me, I was an international student. I couldn't apply for public hospitals. So I've started first at the private hospital, which wasn't my first choice, but I've learned a lot, and I moved on to public after that, which I loved. But the things that I've learned in private hospital was really valuable. And I would encourage any international students who can't apply for public hospitals to apply for any private mental health services. And then, or you can also contact public hospital grad coordinators, because what they usually do is they'll go through the computer match first, and then if they have any unmatched positions, then they will also look at the international students applicants as well. Okay, so thank you very much. That was all prepared, pre-submitted questions. Now we're going to go through the chat, which I know that you guys have already answered, but let me just see if there are anything else that we can see. So one question, so Cassandra has asked a really good question. What is one thing you wish you knew before starting your career in mental health? Anyone?
Oh, I'll start. I think I talk a lot about personality. And when I first started, I thought, oh yeah, you know, I can talk to people. It's easy. You just you'll click straight away. But you do realize that, you know, it's a big world out there. You're not going to get along with everyone. You're not always going to say the right things, but that's also not on you. You know, there are going to be different personalities that you will come across, and you will learn to talk to all those different personalities when you, as you progress in your nursing career. And I mean, I think one of the reflections I had as a graduate was, you know, I was a bigger crybaby than I ever thought I actually was. So, you know, you learn a lot about yourself, not just about your nursing career, but also your personality. So, yeah, definitely be ready for that self-reflection, and you know, you'll find your coping skills there as well.
Yeah, you do become a very self-aware person. That's true. Thank you for that, Roxy. Next question was, do mental health graduate programs offer flexible work agreement? This will depend on the services, so please contact the service. Are the shift times all shift work? No. So I think anyone do shift work here apart from Claire? No one. So
I do some.
you do, oh yeah, because you work at the children as well. Yeah. So a lot of clinical work, if you're in inpatient, yes, there will be shift work, but otherwise there are lots of 9 to 5 positions, especially if you're working in the community, even if you're working clinically. Next questions. Do you have to pay for your grad dip course yourself? There are lots of scholarship. When I say lots, a lot. And there's so much funding through the Department of Health. So most times you don't actually pay for that. Okay. Oh, great, Hannah. I love that you really elaborate. Thank you, Claire, for answering the questions as well. If you decide mental health nursing is not for you after a while, what is the progress like getting into medical nursing? I know lots of general nurses who came to mental health nursing, but I don't really know anyone who went to general nursing. But I'm sure you can. But yeah,
I know a few.
Oh yeah.
I think most people come to mental health and really enjoy it and stay. So there's that. But you can move. It's not impossible. I think in general, when you pick an area of nursing and then try and switch to a different one, often it's about reaching out to the hiring manager or the unit manager and having a talk to them about why you want to change, why you're interested, and what you would bring to the role. And they might be quite aware that you need to learn a lot in that role, but that's sort of probably the best pathway in. There's also transition programs that help you transition to particular specialty areas, and they're open to generally all nurses into that area as well.
Yeah, that's right. But if you want to be an ICU nurse, if that's your dream, don't do mental health grad year. That's very clear. So if that's what you want to do, then you need to kind of, well, not that it really decides your whole career, but you have to realize that, you know, if your dream is to become an ICU nurse, then, you know, of course, you'll have to do the general nursing grad year, because grad year is important for some specialties. Would you say the mental health side is more competitive than med surg when it comes to grad year application? No, And I think Hannah has answered the questions there because it's proportional. Did you want to add? Roxy, did you want to say something as a CNE?
Yeah, I mean, we definitely get a lot of applications. I mean, I wouldn't be able to answer in terms of how much the medical units get, but we definitely get more than what we hire. So yeah, definitely proportional to med.
Yeah. Christy has asked which MH graduate programs would like to be more open to flexible work arrangement. Again, this is service specific, so please reach out to them individually. Okay, what happens if halfway mental health you realize that it's not for you anymore, you don't want to do it anymore? How hard is it for you to leave and stop? Well, if you, with anything, with any grad year, if you think that you can't do it, that doesn't mean that it is end of your nursing career. I do know some really successful nurses who actually didn't finish their grad year and then came back later in their career. But this also is very individual, so we can't really give you a general blanket answer for that. Should we start applying for scholarships now? I'd say no. That's when you start looking at the postgraduate degrees. More questions. Oh, great. Thank you, Daniel, for sharing that. Okay, I think I've answered all the questions, and there are actual really more elaboration within the chat, so I'll share that later. But now I want to open up to our students, and feel free to start asking questions, and you can say, Roxy, I want to ask a question, or Daniel, I want to ask you a question, or something like that.
I was going to ask about work-life balance. I can't remember who mentioned it earlier, but I was wondering how it compared to general nursing. Yeah, thank you.
Was it me? Hi.
Yeah, it was you.
I mean, I probably won't be able to speak on behalf of what general nursing is like. I mean, I know the rostering is quite different. I think in general nursing, you do kind of, the shift work is you do kind of like AM, PMs, and then suddenly you're on night shift kind of thing. I mean, I don't think you do it as a grad, or do you? I'm not sure. No, in general nursing, I mean. But in mental health, I think it was just about getting used to those hours. Because I mean, when you're younger than we are now, I think you do kind of just work around how you're going to have a social life at the same time as having your nursing career. I guess, I don't know much to say. I mean, it's very individual. I think I love the morning shift, but I dreaded the afternoon shift. So when I did a late early, it was okay for me, but other people might not like that. At the same time as well, when you're in your grad program, you do have study days as well. So, you know, yeah, I'm not too sure how to really answer that.
I might give it a go. I think work-life balance is something that's really difficult to learn, but in mental health, we actually have more support. So we have clinical supervisors and we have clinical supervision. So we actually have the ability to debrief at a much deeper level than what a general nurse necessarily has, because I know in the general nursing stream, they don't actually have that same level. Like I'm given a supervisor that I can contact at any time if I've had a shift where there's been something that's really upset me or I just need to debrief, then I've got that option there. So I think that really helps because they've been in the industry for a while and they can provide some very valuable tips as to how to deal with that situation, how to turn off, how to give yourself space. I also think my managers are very good at saying, make sure you're looking after your own mental health because they're more aware because of the industry that we're in, like that you're dealing with mental health on a day in, day out basis. So they're very supportive if you need to take your own mental health day or you need to have additional time off or whatever it is. They are very open to discussing that, which perhaps is not the case more in the general nursing stream. So yeah, but it is a challenge, right? Like it's so different from anything you've ever dealt with before. So it's just going to be, that's what grad year is. It's just, you know, you're normally in with the team as well. So you're in with other grads that are going through the same thing. So you can support each other. Like we have a Facebook group and we go out and we try and socialize and sort of debrief together. So you do feel like, and it's a smaller group than what the general nursing stream is. So you do feel like you're actually part of a smaller, tight-knit group that actually can help you along with that, getting that work-life balance.
That is very true about the debrief. And thank you for mentioning clinical supervision. Thank you so much for mentioning that. That's what my PhD is on, but I always forget to mention clinical supervision to people. So thank you, Claire. Yes, clinical supervision is the Department of Health is making sure that currently implementing that all the mental health nurses in Victoria can have access to clinical supervision and support from their organizations. And also if there is any events in our practice, usually within 24 hours, we have debrief and then people ask you, do you need to take a day off tomorrow or something like that? So people tend to be very non-judgmental and very supportive. That was my experience as well. Thank you, Anya. And I think with work-life balance, it really also depends on how much, it's really individual as well. So for example, Hannah, for example, I'm going to use you as an example. She's somebody who works full-time as managers, but also does clinical work on the weekend as a bank staff at the Children's Hospital, plus does teaching work at La Trobe. So, you know, if you want to do a lot, you can. If you want to have one job, also you can. So it really depends on how much you want to do.
I think probably realistically, coming from someone who does do a lot of things by choice, working in mental health doesn't mean that you automatically have great work-life balance. I think regardless of what job you pick, in nursing or any other career, it's something you have to think about and be mindful of and make decisions about when you go home and what you do in your spare time to, you know, disengage from work brain. And whether you accept overtime or not and how pressured you feel to do that. So I think it's something to be thoughtful about regardless of what grad program or what area of nursing you pick.
Absolutely. Thank you, Hannah.
Can I just say too, you know, I think someone said like, what's one thing you would like to have known having started your nursing career? I think, you know, choosing grad program, it's also really important to potentially choose a site that's relatively close to home as well. You know, I don't regret my time at the Children's, but I reflect traveling an hour up and back, the bearing that had on my work-life balance was quite pronounced. And I didn't realize until I moved closer working at Origin just how much of an effect it had on me. And just to add to supervision debriefing, we've got reflective practice as well. And also all organizations now pretty much have an employee assistance program. They're all different as to what they offer, but at Northwestern Mental Health, they offer a lot of things like access to a nutritionist, you know, psychological sessions for clinical staff, but also psychological support sessions for your family as well, your direct family. They obviously spend quite a lot of money on it, but it's just a really good resource that's out there that not a lot of people think about, you know, when they're in dire straits. And the climate of nursing has changed in recent times, just given burgeoning demand and also COVID. So in some roles, there's also capacity as mental health nurses to work from home. Hannah, you could probably speak to it a little bit better than I could, but intermittently, my understanding is that roles like case managers can do some of their work at home. And only just this week, I was negotiating with my boss to see if I could do some work from home, and she said, "Yep, 1 day a week is fine." So longer term, particularly with community roles, management roles, there is at times and generally that capacity for negotiation, which if you go back 10 years, we probably never would have even asked the question.
Absolutely. And Roxy, you were working from home, I remember last year, right? Yeah, and guys, I'm also a mental health nurse working research and education. And if working from home is what you want to do, then you should get my job because I haven't left the house since Sunday. Okay, next question. Any other one question?
Yes, please. There are quite a few ENs in my current cohort, myself included. I actually already work in mental health, so I already love it and do want to continue. And without sounding, I guess, arrogant about it, I'm kind of questioning how much worth there is in me pursuing a grad program with having some experience, with feeling confident about where to go, who to access, if I have questions, filling in gaps of knowledge and all those things. So in the back of my mind, I'm feeling like, okay, if I don't apply for a grad, it's not the be all and end all. And ideally, I do only really want to commit to a 0.6 elsewhere to maintain at least a 0.4 where I currently am. It's just that where I am now, it is quite niche and it is in a private setting. Yeah, and I would like to branch out into public, have more exposure in a different area. My placement is actually coming up next week in a community health setting, which is something that I'm really interested in. So I would just really love some like honest, brutal, if it must be, feedback about, no, you're on the wrong path, or really push for a grad program, because then I guess I don't want to feel like I'm misleading and say get offered a grad program and then go, well, actually, I don't want to commit to 0.8 or full time, because I really, I like where I am, but I certainly want to branch out. I don't want to completely write it off.
Great, that was a great question, and that'll be very helpful for lots of EN students out there. I'm going to stop that, and other people can answer that. As somebody who did work both in private and public, it's completely different word. When you think that you know everything in public, when you go to private, when you go to public, there's so much you need to learn, because it's just different things that, of course, there are transferable skills like communication skills, but things like mental health act, you don't get to really work much about mental health act when you're in private, for example. If you want to specialize in the future, if you want to go to any, if you want to be really employable in the future, I would strongly recommend a grad nurse program as an RN. That's my opinion. But again, there is no right way. There's no perfect pathway. Everybody's pathway is different. But if I had a choice of doing grad, not doing grad, I would do a grad year.
I think it comes back to that thing we were talking about before, where you get exposed to 3 different areas. And the only way you're going to get that in a safe environment where you're not expected to know everything, you're not stepping in as a bank nurse trying to just pick it up and go. They know that you're a grad. They don't have the expectation you're going to have all of the answers. You have a high level of support. And you get to try 3 areas during your year, your grad year. So I think it's like a great opportunity to explore other areas outside what you're currently doing in your EN mental health role.
Absolutely. And I think one thing that probably lots of us can agree on is that you only see how much you know. So when I finished my bachelor, I thought I knew everything, to be honest. I thought I knew everything about mental health nursing. I finished my master's, I realized I knew nothing, and that's where I am now. So what's really important is that when you think you know a lot, that doesn't necessarily reflect, you wanted the brutal feedback, that doesn't necessarily reflect the reality. So I want you to remember that in your career.
Yeah, and I think that's part of the reason of wanting to branch out into public. And I think I have a good sense that there's a lot that I don't know, and I'm okay with that and open to learning. I'm just not sure how realistic it is that employers will accept a 0.6.
Yeah, that you'll need to discuss that and negotiate that with the employer, and you need to do what's best for life. And one thing that I always want to tell students, regardless of mental health or nurse or not, is always have identity outside of being a nurse. So all your decision, it shouldn't just be about your career, it should be about your life. So make sure that you incorporate other things when you're making that decision.
So sorry, one other thing, Belinda, is that I actually did what you're asking. So I was on 0.8, but decided it wasn't right for my situation. I've got a family and it just wasn't working for us as a family. So I approached my individual NUM. So that is how it works in our hospital. So they couldn't offer me at the start saying you can have a blanket 0.6 the entire time you're on grad year, but they said it is up to the individual unit that you're placed into that you can negotiate with them to get a different FTE. So don't give up, like it could be possible still.
I'll send this.
Sorry, that's my watch.
Well, that's good. Did you say don't give up and then your watch is like, no, I won't give up?
I was just hoping to discuss it beforehand rather than get into it and then feel like, okay, I'm in a position now where maybe I've kind of misled them a bit. But are organisations approachable then beforehand, before doing the computer match? Can we generally contact them and say, look, I want to apply, but I want to stipulate in my computer match a 0.6, and either obviously they accept you or they don't?
That will depend on their needs as well. So yes, you'll have to negotiate that, Belinda, with the services.
Okay, thank you.
No problem. Any other questions?
I think it was just one in the chat. Can I ask the difference of working in private and public as a grad?
Who wants to answer that question? Should I, or Hannah, do you want to?
I guess we can probably both answer it. I actually started working in a private setting whilst I was still in my grad program.
See, no work-life balance there.
And that's because I also wanted to try out something that was quite different. I guess probably the main thing is that in private settings, you're working with people who are voluntarily seeking mental health support in an inpatient setting and have the financial capacity to do so. And that means, I guess, sometimes you're working with people who are quite motivated to address their mental health issues, but also do have the financial means. Whereas public mental health service sees a lot more people that often can't access private treatment, are more acutely unwell. And you do also see people who are receiving treatment under the Mental Health Act, which is really quite different to working with someone who's chosen to come into hospital. And I think we try to encourage all consumers to make choices about their health and their treatment, and to be there voluntarily as much as possible, and to really minimise use of the Mental Health Act. However, you do still see it frequently in public mental health, and it's a very different experience. But I think, Jose, like you said before, there's valuable and important experiences in both. And I'm really glad that I had the opportunity to work in a private setting. It wasn't ultimately where I wanted to stay, but I learned a lot about how the health system works and got exposure to working with different people to who I was seeing in other settings.
Thank you, Hannah. That's great. And I think for me, I both enjoyed working in private and public. The biggest difference is Hannah explained that very well. I guess other differences are, I'm just talking about the private hospitals that I worked in. Usually public hospitals, I do feel they're much more teamwork, and they're much more presence of other people as doctors and allied health, whereas private, you feel like there are always just nurses there. So you sometimes have a little greater autonomy, which can be really good. But also, I feel like in public, you do have more learning opportunities. So it's very different. And private, you may have very specialized programs, such thing like OCD program or mood disorders program or personality disorder unit, whatever, something like that. Whereas in public, you get to see people across all diagnoses, for example, and you probably more work with people with psychosis a bit more in public, which I really enjoy about public. Yeah, so that they are the main differences, I think. And another thing, private, you have to wear a uniform. It's yeah, it's a big difference. anyway.
I was going to say
And-
too, Hosu, I might have overlooked it if it was said, but patient loads as well. And
oh, yes.
like generally as a rule in public, you'll get on average about anywhere from 3 to 5 consumers allocated to you, but in private, correct me if I'm wrong, but I've seen it go as high as 9. So patient loads are generally much higher, but that also reflects, the different risk profiles across public and private as well.
Yeah.
But I remember once doing a bank shift and being allocated 9 patients and meds for an entire ward that I had never worked on. And for that really soured in my mind working in private, because I was just like, I don't know how this is even manageable. But yeah, that I envisaged you'd get very different exposures, different skill sets working in both respective areas.
Yeah, I think it's supposed to be 8. I think 9 is illegal, but yeah, 8. And we have 3 minutes left. So who would like to ask last question? I might ask a question to Daniel, because I think our students may not be very familiar with your role. What does nurse consultant do? Senior nurse consultant do? For you guys to think about your future careers, I just wanted to give you a little bit of
Yeah, thanks, Hosu. So I'm only relatively new to the role, but the role oversees nursing standards within a specific area or network. So effectively, within Origin, we have about 110 nurses. So it's about ensuring that we have appropriate education, that the education is founded on a contemporary evidence base, that we're providing sufficient support for consumers, that we're not just founding our practice on contemporary evidence, but we're also driving evidence-based practice. It's about working in collaboration with team leaders, nurse unit managers to identify needs within the network and respond to them, but also working towards meeting our key performance indicators, like working to ensure that we're minimising the use of restrictive interventions, working to meet Office of the Chief Psychiatrist, safer care mandates and projects. So it's really all encompassing the role, but also chairing meetings, overseeing accreditation standards. Yeah, I suppose those are the kind of core crux of the role.
Yeah, so just wanted to give you a little bit of I guess, picture of what mental health nursing can take you. While we're on it, well, Hannah, what do you do in your work?
So I guess, as you mentioned, I do a few different things. I'm also fairly new to Origin, and I coordinate the continuing care teams. So there's specific community teams that work with different young people. Some of them focus on early intervention for psychosis or mood disorders or personality disorders, eating disorders. And I support all of those teams and I guess make sure that they have adequate support to do their role. Sometimes I can focus more on operational issues like having enough space and making sure that we're working together with hospitals. Even if my day-to-day isn't always entirely clinical, but I also support with clinical issues as well. So it's a bit of good variety. And then in other roles, I've forgotten what your question was, Hosu. What do I do?
What does your role? I just wanted
Involve?
because students often, when they go to placement, they only see nurses who work in clinical areas. They don't really have chances to meet people that are in your positions. So I just wanted to give them a little bit of just a little bit of idea of what other people can do. Yeah. So Belinda, you've asked the question. Yes, so clear answer that, thank you. Any other final questions that people want to ask? If not, I would like to say thank you so much for all our panel guests to come. You've given us a lot of insights, and I'm sure that everyone's very grateful. And I'm glad that this thing worked. It's every time I see you, Hannah, it's still making me laugh because you're so lower down in the chair. But it was really nice seeing my mental health nursing colleagues. And for students, I wish you the best with your grad year application. And again, remember, whatever happens, the first year of nursing does not define your nursing career. So yes, good luck. If you need any help, if you have more questions, always feel free to ask me, and I will ask all the students to please do the MHI student SFS survey. So I really appreciate that. Thank you everyone for giving your time today. I hope you all have a beautiful evening, night. Thank you, everyone.
Thanks, everyone.
I might ask panel to just stay for 2 minutes catch up.